competency for both pulse and respiration for MA 130. The first thing you're going to do, like with most of your competencies, you're going to go to the other room and do your medical aseptic hand wash, and then gather your equipment. So you'll want the patient's chart, a black pen, and a pulse oximeter for this competency. The next thing that we're going to do is call our patient and verify their date of birth, so identify the patient. Brittany? Hi, Brittany.
Hi.
We're going to go right on back here. If you'll have a seat up on the table for me, please. Thank you. Brittany, can I have your birthday, please?
It's January 15th, 1989.
Perfect, that's what we got. All right, today we're going to go ahead and get your pulse, okay? So I'm just going to check your pulse rate.
Okay.
So what I'm going to do is I'm going to just borrow your wrist for a second, okay? So what I want you to do is the patient should relax their arm. If they're holding their wrist up, there's tendons in the wrist that can kind of get in the way, and you might not feel that pulsation. So you're going to take 2 or 3 fingers worth, and you're going to put it on the radial side of the patient, which is always thumb side. So just at the base of that thumb, you'll take 2 or 3 fingers and compress, and you may have to compress kind of hard until you feel that pulsation kind of running under your fingers, okay? So what you'll do is you'll get their pulse, and then you're going to start timing. You're going to time for 30 seconds. In the beginning, you're going to do a full minute to make sure that you're accurate. But over time, and once I check you off and deem you competent to do a full minute, then you can go ahead and cut to 30 seconds. So you'll watch the clock for a full 30 seconds, counting every pulsation that you feel, and you'll take that number times 2, and that is your patient's heart rate or pulse that we'll document in the chart. So I'm going to stand here and wait for 30 seconds. I'm going to count her pulsations. For time's sake, I'm going to pretend like my 30 seconds is up. I felt 40 pulsations, so her heart rate is 80. So I got an 80 pulse kind of locked in my head. So I'm going to go ahead and move on to respirations as well. If I stop and write things down and come back and start staring at my patient, that'll make them really uncomfortable. But that's what I need to do. I need to look at her body because I'm going to look for an inspiration and an expiration to count 1 respiration. So while I'm still holding this, she thinks I'm checking her pulse. I'm going to look at my patient's body. I'm going to look at their back. I'm going to look at the chest area, sometimes the abdomen. It just all depends. It depends on how my patient's sitting, maybe where the shirt is wrinkled in a particular area. Down here in the abdominal area, you'll maybe see the shirt rise and fall, but you need to make sure you're specifically seeing a rise and fall. In women who are larger chested, a lot of times the chest is a lot easier to see. Sometimes it's in the shoulders. You're just going to kind of scan the patient's body without doing something weird like this. Just kind of on the down low, just kind of stay back and find a spot where you're seeing that inspiration and expiration. Then you're going to start your time again for another 30 seconds, remembering my 80 pulse. And then for that 30 seconds, I'm going to count how many times she inhales and exhales. And I'm going to say in this case, I saw her inhale and exhale 10 times in 30 seconds, making her respiratory rate 20, okay? So I have that, and then I'm going to document in that my chart. Start with the peanut butter and jelly. For pulse, which is documented right after temperature, I'm going to have a capital P, and then I'm going to put my 80. Behind that, I'm going to have a capital R for respirations, because it does matter what order you document your vital signs in. It's always T, P, R, then BP. So for my respirations, then I'm going to write a 20. And then that would be all I would need to document for my respirations. But I'm also going to add pulse oximetry to this. So in your office, you may take a pulse manually, meaning hold the patient's radial artery, counting for 30 seconds how many pulsations. Most of you in the office may use something like this, which is a pulse oximeter. So if you've seen it before, it kind of opens. You have the patient place their finger near the sensor, and in about 2 or 3 seconds, you'll see the pulse rate appear on the screen, okay? There will also be another number. Usually it should be a number in the 90s, and that is the percentage of oxygen saturation in the patient's blood. So this mechanism, this device, measures 2 things, not only the pulse, but also the oxygen saturation in a patient's blood. So Brittany, what I'm going to do is check your pulse with the pulse oximeter. So if I could just have your finger placed right in there, okay? It doesn't hurt. It just clamps right on the patient's finger very gently. And then this one has some automatically start. This one has an on-off button. So I press the button, and then I have on here her pulse rate shows up, and then it shows her oxygen saturation as well. So then I can just remove the device from the patient, turn it off, and then document that pulse. And the way that's documented is you would have a capital P for pulse and put the pulse that showed on the pulse oximeter, and behind it you would put that percentage number. Like I said, most of us are young, healthy people, and we're going to be 95 and above easily. A lot of 100s, 98s, 99s. So you'll put that as a percentage, and then you'll put O2 behind it to stand for pulse oximeter. So for pulse oxygen is what that would represent. And then, of course, we're always going to sign it with our first initial, last name. And then depending upon if we're going to go on and take a blood pressure or let the patient go is how we would proceed.